Let's see about eye muscles. There are 6 extraocular muscles that control all of the movement of eye. Superior rectus, inferior rectus, lateral rectus, medial rectus, superior oblique and inferior oblique. The muscles of the eye are designed to stabilize and move both eyes. Special nervous centers located throughout the brain and brainstem interact with each muscle pair, that is right and left, to coordinate precise movement of the eyes with limited conscious input. All eye muscles have a resting muscle tone that is designed to stabilize eye position. During movement, certain muscles increase their activity while others are decreasing it. The first muscle is superior rectus. The superior rectus inserts at the anterior portion of the eye and its origin is behind the eye on the common ring tendon. Its primary function is to elevate the eye and it has mild secondary function of adduction and intorsion. The second muscle is inferior rectus. The inferior rectus inserts at the anterior portion of the eye and its origin is behind the eye on the common ring tendon. Its primary function is depress the eye and it has mild secondary function of adduction and extorsion. The third muscle is lateral rectus. The lateral rectus inserts at the anterior portion of the eye and its origin is behind the eye on the greater wing of sphenoid bone as well as the common ring tendon. Its primary function is to abduct the eye and it has no secondary function. The fourth muscle is medial rectus. The medial rectus inserts at the anterior portion of the eye and its origin is behind the eye on the common ring tendon. Its primary function is to adduct the eye and it has no secondary function. The fifth muscle is superior oblique. The superior oblique is unique. It inserts on the superior lateral, that is ear side, and posterior back of the eye. The anatomical origin is behind the eye on the lesser wing of sphenoid bone, but the superior oblique muscle acts as a pulley and loops back through a connective tissue sling called the trochlea. Even though it is positioned above the eye, its unique use of the trochlea gives it a primary function is to intort the eye. And the secondary function of superior oblique is depression and abduction. The next sixth muscle is inferior oblique. The inferior oblique is also, it inserts on the inferior, posterior, lateral portion of the eye. Its origin on the medial maxillary bone. Function, primary function is extorsion, secondary function is elevation and abduction.